Hello, I'm Dr. Mark Policritti from the Julian Institute of Plastic Surgery in Spring Hill, Florida. And today I'm going to answer some basic questions and show the difference from a structural integrity point of view, as well as what the consistency of the fill material of the currently available implants for breast augmentation as well as for breast reconstruction. What I have here in front of me are three examples of implants. The one in the center is a saline filled implant. The one on my left is the older style silicone filled implant, and the one on the right is the new silicone implant. Well, these two are currently FDA approved. The new silicone implant is a cohesive gel implant, which I will show shortly the benefits of that new material and how the silicone stays within the pocket, within the shell, and from that standpoint is a very nice implant to work with. I have a scalpel here as well as an 18 gauge needle, and I'm going to go through a couple steps and demonstration of how the material that's within the shell stays or does not stay within the shell of the implant. So to start with, the saline implant is filled with saline solution, and this material is absorbed if it leaks out or ruptures by the body, and you typically will have a patient complain of a gradually deflating breast on one side versus the other, and when they're taken to the operating room to exchange that implant, the implant is typically depleted of its saline solution, and that material has been absorbed by the body. So a 18 gauge needle, I'll move over to here to prevent a mess. If the implant does get a pinhole in it, you can see that even with a rather large size needle, the fluid does not immediately come out. And this is what does typically happen with the saline implants. If there is a fold fracture, if there is a crease for whatever reason in the implant, and over time if a small pinhole or weakness develops, the implant typically doesn't explode. It gradually, with pressure and motion, will start to leak, and as it leaks, that material, the saline solution, is completely safe and it is absorbed by the body, and over the course of a couple days typically this implant will deflate completely. But you can see with the rather sized puncture, it doesn't come out without pressure. Obviously, if the defect to the implant is greater, say I'll use a scalpel to recreate that, the implant then will leak at a higher rate, and once deflated, it's basically a hollow shell. All of this saline solution, again, will slowly absorb by the body, and the result will be a deflated implant shell. And that's the implant without the fill. Pretty much as we would expect with a saline or water-filled implant. Now, this implant is the older style silicone, and the silicone that is within the implant shell is more of a viscous liquid consistency. This tends to leave or extrude from the implant shell upon rupture or defect from the implant shell, and is rather sticky and quite messy to remove from the capsule or from the surrounding healthy breast tissue. If this implant was to rupture, to clean it out and to remove all of the silicone is rather troublesome. I'll do the same steps as far as demonstrating what the consistency is like with an 18 gauge needle. Now, if you notice, the material, the silicone material, follows with the puncture and immediately starts to leave the implant shell. Now, it has a consistency that is sticky and almost like a thickened oil. Very commonly, with either type of silicone implant, the body does not absorb silicone, and the silicone stays within the scar capsule of the implant pocket. However, if it leaves the shell, like you can see here, this viscous silicone material sticks and kind of causes a mess. And when there's pressure on the chest wall prior to the implant being removed, this is what the operating surgeon has dealt with, trying to pick away from the chest wall, from the surrounding breast tissue and healthy fat. And as I said, is a little bit more difficult to deal with. So you can see this creates quite a mess. So what I'm going to do, and you can see how this is all over my hands, I'm going to switch gloves. Now, I'm going to clean this 18 gauge needle off from the silicone that is still on there from the older style implant demonstration, and go through the same series of steps with the new cohesive gel FDA approved silicone implant. And with a needle puncture, you can see an immediate difference. The silicone does not stick to the needle and come out. You can see if you come in with a close-up on the puncture hole that I make, even under pressure, I'm squeezing the implant, the silicone very, very minimally comes out past the border of the shell. And then when I let go, it goes back inside. So what you don't have is extrusion or leakage of the silicone material from the capsule, which is a vast improvement over the older design. If I do a scalpel incision and create quite a large defect, you can see that again, under pressure, the silicone is pushed past the implant shell, but on relief of that pressure, it maintains its position within the implant shell. It does not create the same mess as you see from this implant. So I'll try to further demonstrate that. And you can actually, because of the cohesive nature of this silicone, you can cut this, which is almost impossible to do with that because of the consistency. So I think this is a very nice example of the improvement of the implant and the fill material. The cohesive nature of the gel wants to stay within the shell, and that provides a considerable improvement as far as when implant defects do occur and the removal and exchange of those implants. And this has application of benefit to both the reconstructive patient and the cosmetic augmentation patient. And again, you can almost manipulate this as a solid, even though it has consistency of viscous liquid. And it's much, much more cohesive in nature, and I have almost nothing sticking to my scalpel. And again, I think this speaks volumes as far as a visual demonstration of what I tried to describe when asked about the differences between implants of today versus years ago. Again, it's a much nicer material to deal with. And that's basically the demonstration that I wanted to go through today. I appreciate your time in looking at the different implants that we have to offer, and I'd be happy to answer any further questions that you all may have. Thank you very much.